Mayo Clinic Arizona recently announced a new lung transplant program. The goal is to help patients battling end-stage lung disease and in need of a transplant to survive. And to learn more, we welcome Dr. Jonathan Tacuna. He's the surgical director of Mayo's lung transplant program. Welcome to Arizona Horizon. Good to have you here.
Thanks for having us.
You betcha. All right, so this is a new program, correct?
Yes.
Okay, how new?
Well, we just opened the program last year for evaluating patients, and we did our first transplant on May 30th.
Yeah, and I want to talk about that first transplant here in a second, but this targets, as I mentioned, did I get that right? Critically ill patients. I mean, these folks, it's lung transplant or bust. True?
Yes, absolutely. It's patients with specific lung disease where they have no hope, and transplant's the only option. All medical therapies have failed.
Yeah, end-stage lung disease, that means it's just not going. It's just not going to turn around. There's nothing else left.
Correct, and there's a number of indications for lung transplant, such as COPD, idiopathic pulmonary fibrosis, other things, pulmonary hypertension, some genetic diseases too.
We hear a lot about COPD. What is that?
COPD is an end-stage form of lung disease where the sacs of the air in the lung are actually destroyed, and you can't exchange oxygen anymore, and you're running out of options.
Yeah, and so here we go with the lung transplant idea. This involves a multidisciplinary team, correct?
Huge team, and it all involves everyone really touches all parts of the institution, much like anything in transplant.
And it's research-driven?
Yes, absolutely.
Yeah. So talk about how different teams would work together on something like this.
Well, it starts with the evaluation of the patient to become a candidate. Because donor lungs are in scarce supply, as many donor organs, we want to make sure we're picking the right recipient. And so during the evaluation piece, they meet all people from across our disciplines: infectious disease, pulmonologists, surgeons, social workers, cardiologists, all those folks, and other consultative parts of the practice as needed.
Sounds like all hands on deck, in other words.
Absolutely.
Yeah. Okay, so ramping up to the program being, then we get in this first patient, I'm going to get to him, I swear I am. Ramping up to this, was there an advancement? Was there like an aha moment where, all right, we're doing this?
I think it was 6 years ago when I got here. So I was actually walking on the Mayo Clinic campus as I was thinking about the future on that campus, and walking around looking at the potential for the innovation that goes on. And I looked up in the sky, it was January. I'm from the Midwest, yes. The weather was perfect. And I said, this is the place.
Yeah, well, this is the place. Okay, so the place gets its first transplant patient. This was, I think he had surgery May 30th, as you mentioned. Talk to us about him, his condition, and how it turned out.
Yeah, he's a 67-year-old patient with COPD, running out of options. He had COPD diagnosed about 7 years previous, but like many patients with the disease, they decline, and it affects their daily lives, so much so that they have to choose between talking and breathing. Wow. Even. It's that significant. And he was a great candidate for transplantation when he went through an extensive process, and then some donor lungs became available for him.
Yeah, he was a great candidate because
there's a lot of components that go into it. He really just had lung disease as his main thing. His heart was good, his other organ systems were good, and also there's a lot of other things that go into picking an appropriate recipient, including family support,
yes.
The support around him, because it does take a village with these patients.
Yeah, it apparently takes a gong too, because we just saw him hitting the gong here. Sounds like everything went pretty well, huh?
Everything went great, and he couldn't have, I have this philosophy with lung transplant and many other transplants called N+1. So when you find a recipient, and you want that recipient who's always going to do the extra step. With Craig, our first recipient, it was when I asked him to walk 3 times after surgery, he was walking 4.
There you go.
And that's what you need to be successful with such a complex operation.
How's he doing now?
He's doing great. He just celebrated his 2-month anniversary. He has no rejection. He's really has a new lease on life, and his lung function is outstanding. It's about 102% predicted for his size and his age.
Wow.
Yeah.
And he can get around and do pretty much what he wants to do, I would imagine.
He does, not using oxygen at all. Now, the trade-off for that is you see doctors, you take some medicines to keep your immune system from fighting off the transplant.
Yes.
But he is, the way he approaches things, and I talk to him and his wife quite frequently, they just have a whole new outlook on life. And that's the hope that transplant provides for patients.
Yeah, that is great to hear. Last question here. This type of transplant, lung transplant, can the techniques, the multidisciplinary approach, all these things, can they be applied to different organ transplants?
Absolutely. As a matter of fact, our transplant center is one of the busiest in the country, if not the world. And that's the infrastructure you need. And that multidisciplinary approach is standard across all organs.
How many patients do you think will we expect to benefit from this, from the lung transplant in particular?
Yeah, we're targeting right now in a range of 30 patients a year to get transplanted, because those are the patients that we see on an annual basis that we would like to be able to offer this as an option for them.
Well, it sounds very encouraging, and congratulations on your success and your patient's success. And we'll keep an eye on it because it sounds like it's a good story. Good to have you here.
Thanks. Appreciate the opportunity.